Is hypertension truly primary? Understand orthostatic hypertension with hypertensive emergency. Surgical weight loss, what do we learn from this? And intuitive lifestyle and digital therapeutics, what is the scope in hypertension management? These are the things we'd like to quickly cover today. This is a paper we presented at the AHA last month in Chicago, and we are talking about orthostatic hypertension. And this story starts millions of years ago, with us moving from the ocean and developing from a single chamber, double chamber, 3 chambers, now to the 4-chamber heart that we have, primarily because we want to be more mobile and we want to stand up against gravity. So standing up is a basic human right. Primary essential hypertension, risk attributed to excess weight. Because of limited time, I'll tell you the answer. 75% of essential hypertension is due to excess weight. When we talk about, this is the WHO website that says there are some modifiable and some non-modifiable risk factors in essential hypertension, but when we piece each and every one and see how much the risk attributed, the biggest risk in modern era is obesity. Severe obesity, BMI more than 35, increases the likelihood to develop hypertension 7 times. This is enormous. So this is a patient who taught me a lot of cardiology. He is a 41-year-old health inspector for the state of Missouri, BMI of 55 because his weight is 183 kilograms. He presented with presyncope and blurring vision for 2 years. Every time he stands up or walks. He has seen several cardiologists, and he was on olmesartan and hydralazine. His supine blood pressure is 120 by 80. When he just stands up, his blood pressure goes up to 180 over 85. And this persists. What is the entity? This is orthostatic hypertension. And the best treatment, do I need to hospitalize him because he comes to my clinic? Should I recommend gastric bypass surgery, intuitive weight loss, or lifestyle with aerobic exercise and dietary approaches to stop hypertension, the DASH or maybe Mediterranean diet? Orthostatic hypertension is variably defined, poorly understood, but by and large, 10 millimeters systolic blood pressure increase on standing up defines orthostatic hypertension. This is not the reason why we check orthostatic blood pressures. We check it to catch people with low blood pressure on standing up, especially above the age of 60 on diuretics. But this is a new problem that is now becoming more and more prevalent. The prevalence of orthostatic hypertension is considered to be between 2 and 30%. The wide variation is because of different populations being reported. And generally we say hypertensive urgency if systolic pressure is more than 180 without target organ damage. But if there is an episode of hypertensive urgency, mortality goes significantly higher. It's about 9% per year. In our own clinic, in my cardiology practice, in about 12, 13 months time frame, we screened everybody who comes to my clinic, 493 patients, and we identified 39 patients with orthostatic hypertension of more than 10 millimeters on standing up. Average age was 58 in my clinic, weight was 127 of this group, and BMI was 47 for the people who had orthostatic hypertension. This is huge. BMI more than 35 is severe obesity, more than 40 we can call it morbid obesity. This is 47 average BMI. And if you look at the blood pressure variation, the systolic pressure increase was 23 millimeters and diastolic pressure also went up by 13 millimeters in these 39 patients. So if we talk about resistance training, aerobic exercise, I'm thinking just standing up itself is an exercise for these obese, sedentary people. DASH diet, Mediterranean diet, plant-based options, all these are proven to improve blood pressure, but we may need something more to help these patients. Maybe gastric bypass surgery. We have data from the last few years looking at resistant hypertension at baseline. With medical therapy, it's not changing, but with gastric bypass surgery, it becomes nearly zero. This study is called Gateway, published in 2018, and this is a very, very interesting graph. What they are showing is, importantly, gastric bypass causes about 30% weight reduction over 1 year. The important thing is lifestyle, medical therapy, rehabilitation, all these things with best diet, there is zero weight reduction. That is the challenge with traditional lifestyle. But what is more interesting in this graph is the percentage of patients whose refractory hypertension disappeared. All the blue curves show that, the bars. But the blood pressure improvement did not wait for a year. It happened right away after the gastric bypass surgery. And the reason for that is because of the dramatic 90-95% calorie reduction that patients undergo for the first few weeks because of the gastric bypass surgery. So it is natural ketosis once again that is contributing to the dramatic reduction in blood pressure immediately. The weight loss takes 1 year. Blood pressure improvement happens right away. So systolic hypertensive response to exercise is an entity that as cardiologists we are very familiar. On the treadmill, when the blood pressure tends to go up with exercise, especially the systolic blood pressure, when it crosses 210 for men and 190 for women, we call it exaggerated hypertensive response to exercise. And this is more prevalent in obesity, hypertension, diabetes, and with low level of fitness. So why do some patients develop orthostatic hypertension? Increased sympathetic activation. Standing itself becomes an exercise because of their sedentary lifestyle, inflammation, arthritis. There is anxiety with standing up because they've been on a wheelchair for too long, fear of injury. All these things may be contributing. This is a very interesting graph. Again, patient is teaching me that with his weight reduction, we are able to see improvement in his standing systolic blood pressure. So the sitting blood pressure that we are used to measuring after 3 minutes, 5 minutes is great to diagnose hypertension. But once you make the diagnosis and start medicines, I'm now moving more and more towards measuring standing blood pressures at home or even in my clinic settings. So in our mindful eating program, I believe the acute reduction in blood pressure is because of sympathetic activation coming down, cardiac workload coming down, volume excess and mental stress coming down. And within months, with mindful eating, we are able to see reduction in inflammation, arthritis, and body fat. These are 3 patients. For want of time, I'm not going to go into details, but in red, what I'm showing is the systolic pressure increase on standing up. Their BMI is 55, 80, and 43 to start with. And you can see high sensitivity C-reactive protein is coming down dramatically in many of these patients within weeks. This is a very interesting graph I want to spend a few seconds on. When we see the weight in the y-axis and over time, this individual listened to me when I saw him in May of 2021. He started eating much, much better, anti-inflammatory, fasting, once a day eating, a lot of mindfulness, positive psychology, and his weight came down from 183 kilograms down to 175 kilograms. It's not a very big drop, but his systolic standing blood pressure dropped, that's the red marking, about 50 points from 180 to 130. And then with his life becoming more stressful in the pandemic and some of his colleagues giving away their job, he had to work more hours. He ate like before and his weight gain was again connected with this systolic pressure going up to standing of 200. And second time when he's following our methods, we are seeing significant improvement in the standing systolic pressure. So blood pressure correlates with weight. Standing blood pressure, please check that in the future. This is the kid you met. He's only 27 with severe obesity, hypertensive encephalopathy in the ICU, cardiorenal syndrome. And with his mindful eating, losing now 35%, he has resolved his hypertension. He still takes very low dose 1 or 2 medicines, but he's truly feeling much more energetic. This story you already saw. So we are able to achieve about 25% weight reduction. And this is a nice way of looking at this. Paroxysmal hypertension, we know mental stress can do that in about 3% of patients. Orthostatic hypertension occurs in about 2.5% of people, where about 10-20 millimeters mercury increase. Orthostatic hypertensive urgency, when systolic pressure exceeds 180 millimeters mercury, is extremely rare even now, fortunately. And this is very similar to hypertensive response to exercise. That is what I wanted to remind. In obese patients, this may be as high as 25% of obese patients may have orthostatic hypertensive urgency. I want to thank several of my collaborators who come from Siddha medicine in our part of India. It's been around for 5,000 years, so they are guiding me in how to teach these mindful methods. I have psychiatry, cardiology, and exercise physiology colleagues, as well as positive psychology collaborators working with me in this program. To conclude, orthostatic hypertension occurs in up to 25% of patients with severe obesity, BMI more than 35. Standing blood pressure may be more important once the diagnosis of hypertension is made and medications are started. Exercise cannot be initiated when pressure goes up with standing because it is dangerous. So the best way is intuitive weight reduction. Essential hypertension is secondary to obesity. In India, if the BMI is more than 23, please work on their weight. You will see so much good results with weight reduction. Refractory hypertension, exaggerated hypertensive response to exercise, white coat syndrome, orthostatic hypertension, all of them are interrelated and they respond very well to intuitive lifestyle and digital therapeutics. So positive psychology is important, inflammatory diet, fasting, flow, and finding meaning in life reverses orthostatic hypertension. I left the email address support@refresh.health if anyone is interested. We want to train patients, certify them. At the same time, we want to train doctors and nurses and dietitians, pharmacists, whoever is interested in this type of intuitive wellness. In the US, we have started this program for the VA system. From 2023 spring, we're going to start the training. So if anyone is interested, the world is open in the online era, so we are happy to give this type of education so that you will be empowered to take care of your patients with these intuitive, low-cost methods. Thanks so much for this opportunity.